Sometimes people can surprise you. The NHS hadn't expected heart checks to be so popular, but around 1,000 people turned up for this free consultation in Hove.
I got a text from the local surgery saying this was happening today, and yep, that's why I'm here.
The doctor sent me a link saying to come along for a free heart health check, so I thought I'd take the opportunity.
No concerns with your heart as you stand here now?
Hopefully not. Heavy weekend, but other than that, no concerns.
Well, I just thought it's a good reason to come along and just get my heart checked. If there is an underlying issue, it can be dealt with promptly. So that's why we're
surprised at the number of people here?
Really surprised. We've been waiting an hour to get to this point, and we got here at 10 to 10. So yeah.
290.
Once inside, there were heart specialists from hospitals across Sussex offering the consultation, blood pressure checks and heart rhythm checks.
So have you said yes to any of these questions?
The purpose of today is to pick up patients with undiagnosed high blood pressure, rhythm changes, something called atrial fibrillation, and also ask the patients to fill in a questionnaire, and if they meet certain criteria for us to suspect that they may have a problem with their heart pump, so heart failure, we can do a finger prick test for a biomarker, so a blood test that can that will be elevated if they do have stresses on their heart muscle.
I think mine might be linked to COVID, so I'm having trouble breathing, just generally doing basic stuff like getting dressed, carrying shopping, going up a small incline. So we've looked into lungs and that's fine. So obviously the next step was to see whether it's linked to the heart, and then this was on, so it was like perfect timing in that sense.
Well, this must be about our 17th or 18th event now since the start of 2024. But both hypertension and atrial fibrillation can lead to heart failure. So the earlier you pick it up, the earlier you treat it, the better it is, better quality of life for you, and the better length of life prognosis you have.
Heart disease is one of the most common illnesses in the UK. Treatment is more successful and survival rates are higher than ever before. So anything we as individuals can do to improve our heart health should be welcomed and is certainly encouraged by the health service.